Hello, I'm Dr. Lyra Benton, and welcome to my Urology and Men's Health channel. Today, I want to talk about something that's often overlooked, something many men dismiss as just part of aging. It's when you suddenly don't feel the same. Maybe you look in the mirror and don't see the man you used to. Less energetic, more moody, a decreased libido. It's like something's missing. Did you know that the hidden cause behind many of these symptoms is falling testosterone levels? But falling testosterone levels aren't just about low libido. It's a complex issue that profoundly affects your physical, mental, and emotional health, trapping you in a vicious cycle. This video will help you understand the real signs of falling testosterone, normalize it, and take the first steps to regain control of your life. This isn't just about hormonal imbalance, it's about finding yourself again. An in-depth look at physiology. Why does testosterone drop? Testosterone isn't just a hormone responsible for sex drive. It's the primary male hormone, shaping a man's identity, energy, muscle mass, bone density, ability to focus, and even mood. Testosterone levels fluctuate naturally throughout a man's life cycle, peaking in his 20s and then declining naturally by an average of 1% per year from age 40 onward. The European Association of Urology describes this condition as a clinical syndrome caused by androgen deficiency. While not every man experiences the same symptoms known as andropause, low levels are associated with obesity, diabetes, and many other chronic diseases. Therefore, we understand that this decline isn't just an aging process, it's a condition that needs to be addressed. So, what factors accelerate this decline? Research shows that lifestyle factors such as sleep disorders, excess weight, untreated sleep apnea, chronic stress, smoking, and alcohol use can accelerate this decline in testosterone levels. Similarly, metabolic issues like high blood pressure, high cholesterol, and insulin resistance can also trigger this decline. On the other hand, good sleep, regular exercise, a healthy diet, and managing stress help maintain healthy testosterone levels. In this context, you can see that the decline isn't just related to age, but also largely related to lifestyle choices. Hidden signs. It's not just about the bedroom. While the most obvious signs of low testosterone often relate to sex health, this is only part of the story. Let's take a look at the most common symptoms, from the physical to the emotional. One of the most common complaints of low testosterone is a decrease in sexual desire, or loss of libido. Sometimes this can be accompanied by erection problems. Libido and erections aren't just about sexual health, they're also indicators of your overall well-being. Mayo Clinic experts emphasize that low testosterone symptoms can mimic those of other conditions, such as high blood pressure or diabetes, and therefore should be evaluated by a specialist. For example, a decrease or loss of spontaneous morning erections is a significant sign that your testosterone levels are declining. Other changes occurring in your body may also indicate this condition. Loss of muscle mass and fat gain. Testosterone plays a critical role in maintaining muscle mass. When levels drop, muscle strength and endurance decrease, while fat accumulation, particularly in the abdominal area, can occur. This condition is called sarcopenia and can lead to a significant decrease in physical performance. Bone weakness. Testosterone is also a key hormone in maintaining bone mineral density. Low levels can lead to a decrease in bone density and an increased risk of osteoporosis. Research shows that testosterone affects bone health through the conversion of estrogen, and men with low testosterone levels are at a higher risk for low bone density and fractures. Other physical symptoms. Less obvious symptoms such as loss of energy and stamina, chronic fatigue, breast swelling, and hair loss may also occur. Research conducted by the EAU reveals that fatigue, depression, memory problems, and difficulty concentrating are common in men with low testosterone levels. Mental and emotional changes. The secret war in your mind. Many men label the emotional and mental symptoms of low testosterone simply as the pessimism of aging. However, this is a topic that deserves further investigation. Low testosterone not only affects mood, but can also contribute to depression, anxiety, and decreased mental clarity. Depression and loss of motivation. Research shows that 35 to 50% of men with low testosterone levels experience depressive symptoms. These symptoms include a persistently depressed mood, a loss of pleasure in previously enjoyable activities, and loss of motivation. The vicious cycle theory. The key point here is that while low testosterone can lead to depression, depression and chronic stress can also suppress testosterone production. This creates what's known as a vicious cycle. Low testosterone makes you feel depressed, which further lowers your testosterone levels. Proper diagnosis is crucial to breaking this vicious cycle. Focus and memory problems. Low testosterone also has negative effects on cognitive function. Symptoms include difficulty concentrating, poor memory, and decreased intellectual capacity. This can create the feeling that your brain isn't functioning as it used to, and it can lead to problems in your work or social life. In a moment, I'll explain how these symptoms aren't just hormonal issues, they can also be a sign of more serious health issues. I'll explain what medical research says about this issue and how we can stop this deterioration. Stay tuned. This medical perspective. Is low testosterone a warning sign? The underlying causes of low testosterone can sometimes be a sign of a much more serious health problem. The American Urological Association and many other health organizations indicate that low testosterone can be a risk factor for cardiovascular disease. Dr. Quram Nasir, a preventative cardiologist at Houston Methodist Hospital, states that low testosterone negatively impacts heart health and may even be considered a risk factor for heart disease. According to Dr. Nasir, the metabolic problems caused by low T, including impaired glucose metabolism, bad cholesterol levels, and inflammation, are closely linked to heart disease. This suggests that low testosterone is actually a biomarker of overall health. Other common risk factors for low testosterone include obesity and type 2 diabetes. Obesity leads to metabolic problems that lower testosterone levels and increase the risk of erectile dysfunction. Low testosterone and ED are also more common in men with type 2 diabetes. Low testosterone can increase insulin resistance, creating a vicious cycle that worsens both hormonal imbalance and metabolic problems. Sleep apnea and stress. Symptoms of sleep apnea, such as snoring and waking up without being rested, can accelerate the decline in testosterone levels. Chronic stress also increases cortisol levels in the body, inhibiting testosterone production. These conditions can disrupt the brain signals that regulate the production of testosterone and other hormones. Medications. Chronic narcotics and some corticosteroids can affect testosterone levels. Therefore, it is important to discuss the effects of your medications on your hormonal balance with a specialist. In a moment, I will explain what tests are performed during the diagnostic process to solve these problems and what options await you, from lifestyle changes to hormone therapy. What to do? Diagnosis and management roadmap. When you notice symptoms of low testosterone, the first and most important step is to consult a specialist. Authoritative organizations such as the American Urological Association recommend a proven protocol for diagnosing low testosterone. Blood test. Diagnosis is made when the total testosterone level in your blood is below 300 ng/dl on two separate measurements, preferably early in the morning. Morning time is important because testosterone levels fluctuate throughout the day and are typically highest in the morning. Physical examination. In addition to assessing your symptoms, your doctor will also check physical signs such as the size of your testicles and your muscle mass. Other tests, once low testosterone is diagnosed, further tests may be performed to identify the underlying cause. These tests may include prolactin and luteinizing hormone, or LH, thyroid function tests, and blood counts. Now let's take a look at the treatment and management tactics of this personal journey. When you receive a diagnosis of low testosterone, it's not the end, but the beginning of a better quality of life. As the AUA notes, treatment options can range from lifestyle changes to hormonal replacement therapy, or HRT. However, this decision should always be made in consultation with a specialist, taking into account your individual health condition and goals. Lifestyle changes. Because conditions like obesity, insulin resistance, and chronic stress lower testosterone levels, taking steps to address these issues can help you naturally restore your hormonal balance. A healthy diet, regular exercise, especially strength training, adequate and high-quality sleep, and weight control are the most important steps to support your testosterone levels. Hormone replacement therapy, HRT. In some cases, lifestyle changes may not be sufficient, and your doctor may recommend hormone replacement therapy. This treatment aims to increase testosterone levels through gels, injections, or implants. However, this treatment should be carefully monitored due to its potential effects on cardiovascular disease and prostate health. The Mayo Clinic notes that this treatment can cause side effects such as edema, fluid retention, in patients with heart failure, liver, or kidney disease. Therefore, it is crucial to evaluate the risks and benefits of this treatment with a specialist. According to AUA guidelines, it is essential that patients are informed about the potential risks and undergo prostate cancer screening before starting treatment. Summary: take care of yourself above all else. Today, we've discussed the possible reasons why you're not feeling your best, the subtle signs of low testosterone, and the importance of normalizing this condition. Remember, this isn't just a hormonal issue, it's a reflection of your overall health. This journey isn't something you should be ashamed of, it's a reflection of how much you value yourself and your health. Instead of ignoring the symptoms, you can take back control of your life by taking a proactive approach. If this video helped you, don't forget to share it with your friends who need it, comment, like it, and subscribe to the channel. See you in the next video, and take care of yourself.